Hi, I'm Dr. Ian Johnston, continuing our series on playing in the sandbox with Cerner. In our last video, we went through the process of creating a history and physical or consultation note using standard Cerner workflows. I think most of you would agree that although not overly onerous, it does take a bit of time and is certainly more than one would want to do on a daily basis on every patient. In this video, we're going to turn our attention on how to efficiently create shorter notes, for example, progress notes or other very brief follow-up notes that don't need excessive details. So here we are back in the patient's chart. Same patient as yesterday with the wheezing and shortness of breath. Our little boxes are clear, so we can enter information into them if we would like. One option for creating a short progress note would be to choose a few boxes and fill them in as we did yesterday. We'd likely do subjective, objective, assessment, and plan, and then use that data to pull into a SOAP note. So let's try that out and see how it goes. Patient had a good night, period. No concerns from nursing, period. Continues on 30% oxygen, period. Requiring masks every 2 hours, period. Patient has minimal residual suprasternal indrawing, period. Still wheezing bilaterally, but improved from yesterday. Significant improvement, but still requires 24 hours in hospital, period. Will wean masks as tolerated, period. So there we go. We've done our little note, and let's see how that looks in note form. And we can see that the information has been drawn in as expected. And it would be perfectly fair to sign and submit and call that a day. Now, that's not the only way to skin a cat, so let's discard this and try it again in a slightly different way. This time, instead of using the little boxes, I'm going to go directly to the note and dictate in the places provided. For example, I could say essentially the same thing again. Patient did well overnight, period. No concerns from nursing, period. And so on. Until we have built our note, then sign, submit, and away we go. Now, some of us don't like all this extra clutter. If we want to eliminate some things, if we don't want lab results, we can simply knock them out. If we don't want input and output our medications, we can simplify the note down as far as we want. Now, some of you are no doubt asking, why would I want to spend time every single day deleting information from an overcrowded note? And that's a very good question, and that's why you can easily construct your own template that meets your fancy. So let's go back again to documentation. We'll discard this as well. And if we look down here, up until the present time, we've only used the standard canned notes. If you don't like that, there are many more. And as you can see, there are in fact dozens of them, and one or more of them may suit your needs. The other option would be to simply start from a blank slate. Free text note is an available option. One would need to identify what kind of note you're doing if you're doing a free text note, but then you're essentially starting with a blank slate, and you could simply freeform whatever you wanted. If you want to be a bit more elegant than this, you can create your own template in just a few minutes. One can do this using the Cerner auto texts. And to use this, we simply click on this little button up here, and we have a menu that comes down. Let's say that I want to create a new template for my daily notes. So we'll click that, and I will call it .Ian mini, and it'll be for short notes. And then I can move on from there. There you go. I've created perhaps the simplest template ever with just 2 headings that I could dictate into and have a nice clean looking note. Taking this to a slightly higher level, one can automatically enter whatever information one likes that is present in the system in discrete form. For example, I will often start my notes saying this is a 5-year-old child who was admitted with asthma. She's been in hospital since whatever date, and this can be done using simple tokens. So perhaps I would like to make a slightly more sophisticated template, so I'll go back to that template that I just did, and I will edit it. And I'd like to add a bit more to it. In each time I pull up this template, I want to see the patient's age, so I can do that using this button right here. And we can see that we can choose from about 54 pages of patient information that could be inserted into a template. So I want just age, so we'll search for that. And there it is, and we'll insert that. So that's good. And the next thing I want is a gender. So I will do the same thing, search gender, and so on, until I have built what I find to be a pleasing template. Now you can see I've added a couple of more things, so each time I pull up the template, I'll have entered the patient's age, gender, the chief complaint, and their admission date. And then I can dictate any additional details that I would like. I'm going to save that new template. It's called Ian Daily Short. And now, whenever I want to, I can use this to move my day along more quickly. So for example, if I wanted to use that template here, I could just type in Ian Daily Short, and there we go. So a simple matter to add to that note. Now, it's very possible to do this even more quickly. It's a simple matter to change, insert a template using a voice command, but we'll have to save that for another video.